In this video, I will explain parotid gland in a simplified manner in about 6 minutes. This is the parotid salivary gland. Parotid is the largest of the three salivary glands in the human body. It is irregular in shape, yellowish in color, and appears like a lobulated mass. It is shaped like an inverted pyramid with the apex facing downwards and the base facing upwards. Its location is in front and below the external acoustic meatus. It is present between the ramus of the mandible and the sternocleidomastoid muscle. A part of it projects over the masseter muscle. The parotid gland is enclosed within the investing layer of deep cervical fascia which extends from the neck over the parotid gland. This fascia is unyielding in nature and does not allow space for the parotid gland to expand. So if there is any inflammation of the parotid gland, it will cause severe pain, which is also because of the stimulation of the great auricular nerve. The borders and surfaces of the parotid gland are as follows. This is its apex. This is the base. Its outer surface is its superficial surface, which is this. This is the anteromedial surface present here. This is the posteromedial surface present here. This is its anterior border, this one. This is the posterior border, this. And this is its medial border. Relations of borders and surfaces. This is the apex to which is related the external carotid artery and retromandibular vein. This is the base to which is related the external acoustic meatus, temporomandibular joint, superficial temporal artery, and auriculotemporal nerve. This is the superficial surface. To the superficial surface is related skin, superficial fascia, parotid fascia, superficial parotid lymph nodes, and great auricular nerve, which is a sensory nerve present in the skin overlying the parotid gland. This is the anteromedial surface of the parotid gland, which is related to ramus of the mandible, masseter muscle, and medial pterygoid muscle. This is the posteromedial surface of the parotid gland, which is related 1 to the mastoid process with the muscles attached to the mastoid process, namely sternocleidomastoid and posterior belly of digastric. 2. It is related to the styloid process with all the attachments of the styloid process. This is the parotid duct, which is related to the anterior border. To the anterior border is also related the terminal branches of the facial nerve and the transverse facial blood vessels. Posterior border, which is this, overlaps the sternocleidomastoid muscle. This is the medial border and it is related to the lateral wall of pharynx. Other than the structures related to the borders and surfaces of the parotid gland, there are three structures which pass through the substance of the parotid gland and form a clinically important relation with the parotid gland. These structures are the facial nerve and its 5 terminal branches, external carotid artery and its terminal branches, and retromandibular vein. During the parotid gland surgeries, care must be taken not to cut any of these three structures. Facial nerve, if cut or damaged, will result in paralysis of that half of the face. Blood vessels, if cut, will lead to profuse bleeding. Blood supply to parotid is by external carotid artery and its branches. Venous drainage is in the external jugular vein, and lymphatic drainage is in the parotid or preauricular group of lymph nodes. The secretomotor pathway of the parotid salivary gland begins in the inferior salivatory nucleus in the pons. The preganglionic fibers pass into the glossopharyngeal nerve, then into its tympanic branch, into the tympanic plexus, and then into the lesser petrosal nerve. The preganglionic fibers relay into the otic ganglion. The postganglionic fibers arising from it pass along with the auriculotemporal nerve to reach the parotid gland. This is the parotid duct, which is also known as the Stenson's duct. It is 5 centimeters long, emerges from the anterior border of the parotid gland, runs over the masseter muscle, pierces the buccinator muscle to open in the vestibule of the mouth opposite the crown of the upper second molar tooth. For the parotid gland chapter in detail along with the applied anatomy, go to chapter 4 of the playlist of head and neck by clicking on this icon. Click here to like this video and subscribe to the channel for more such informative videos on anatomy for easy learning.